What is transferrin saturation for anemia in Ra? Transferrin saturation is an important laboratory test that helps evaluate iron status in people with anemia related to rheumatoid arthritis. It measures the percentage of transferrin, which is the protein that carries iron in the blood, that is bound to iron. Understanding transferrin saturation is crucial because it helps differentiate between different types of anemia that can occur in rheumatoid arthritis, such as iron deficiency anemia and anemia of chronic disease. In cases of anemia associated with rheumatoid arthritis, transferrin saturation is often reduced, typically falling below 20%. This reduction happens because both iron deficiency and inflammation limit the availability of iron needed for producing red blood cells. However, transferrin saturation alone does not provide a complete picture. It must be interpreted alongside other iron markers, such as ferritin, to determine the specific type of anemia. For example, in iron deficiency anemia, transferrin saturation is low, and ferritin levels are also low, indicating that the body's iron stores are depleted. In contrast, in anemia of chronic disease, transferrin saturation remains low, but ferritin levels may be normal or even elevated. This occurs because inflammation causes the body to sequester iron, making it less available for red blood cell production, even if there are adequate iron stores. Sometimes, patients may experience a combination of both types of anemia, which can complicate the diagnosis. In this case, transferrin saturation remains low, ferritin levels may vary, and transferrin levels can also fluctuate. This mixed pattern reflects both true iron deficiency and the effects of inflammation. Interpreting transferrin saturation accurately is vital for effective management of anemia in rheumatoid arthritis. It should be considered alongside ferritin levels and inflammatory markers, such as C-reactive protein or erythrocyte sedimentation rate. For instance, a low transferrin saturation with low ferritin and no signs of inflammation typically indicates iron deficiency anemia. Conversely, low transferrin saturation with high ferritin and active inflammation suggests anemia of chronic disease. Clinically, transferrin saturation is used to assess how much iron is available for producing red blood cells. It helps healthcare providers distinguish between anemia caused by iron deficiency and that caused by inflammation, guiding treatment decisions like iron supplementation or anti-inflammatory therapies. In summary, transferrin saturation below 20% indicates limited iron availability in patients with rheumatoid arthritis. However, it is essential to combine this information with ferritin and inflammation status to accurately identify the underlying cause of anemia and determine the best management approach. Managing anemia effectively is crucial, as it can significantly impact fatigue and overall quality of life for individuals with rheumatoid arthritis. Always consult healthcare professionals for personalized advice and treatment options.